with a little health and a little wealth and a lot of love.
And the one thing that was specifically tied to PCOS in general that didn't necessarily correlate with body mass or with weight is uterine cancer. So those with PCOS do tend to have an increased risk of uterine cancer, and that's independent of what their weight is.
Yeah, I think it's important for individuals to make sure that they are diagnosed so they can properly treat this. A lot of people just don't know that they have this. So how would you diagnose?
Yeah, and so some of that is kind of goes into what the common symptoms are, and the common symptoms of PCOS, there's such a wide range because you don't fit into a specific bucket sometimes with PCOS. There are actually a lot of different what we call phenotypes of PCOS. So you can have a lot of different, some women have the same characteristics while others don't. And so sometimes the only symptom that the patient might complain of is just infertility. They're having a hard time getting pregnant. Other symptoms, we'd mentioned the hirsutism. So women will have other signs of estrogen excess. So they'll have abnormal kind of male pattern hair growth, but not just that hair growth, but also hair loss. So they'll have male pattern hair loss. They'll lose a lot of hair around the temples. They'll have significant thinning of their hair that's not anticipated, especially for their age group. And then the other thing is abnormal. It kind of goes with the infertility, but abnormal periods. So periods that don't come at the same time every month, irregular periods. And then other signs of androgen excess, a lot of times can implicate hormonal acne. So acne around the jawline can be a sign of androgen excess. And those are the main things. The other thing that sometimes we think about, and something that they mentioned more in these kind of functional medicine lectures, was the abnormal circadian rhythm. So for whatever reason, these women tend to be night owls, that they have their whole system is kind of thrown off.
Interesting.
Which also can throw off cortisol levels and further contribute to insulin resistance and weight gain. And then some symptoms of leaky gut as well.
Right, which we all know about leaky gut. So something we talked about in leaky gut was the microbiome, one of our first few episodes. If you want to know more about that, let us know. This is hard for me to digest because if you're telling me the only way that I know if I'm a woman that I have PCOS is symptoms like infertility, excessive hair growth, acne, is there any other way they could be diagnosed?
For me, it's something that is always on my radar when I have patients come in.
For you, yes.
Yeah. It's one of those things where, and maybe it's something that I've always been drawn to and I've been interested in, but if you have, and this is a common complaint, women will come in and they'll complain about, the biggest complaint is the weight, the difficulty losing weight, the feeling like they're putting on weight without any other lifestyle change. And a lot of times those younger women will also complain of irregular periods. I mean, these are common things that women complain of all the time. Right. And if all of those come together, and sometimes you will see a patient and you'll know when they come into your office. So it's not just, there are other signs of insulin resistance. So it's not just the symptoms of androgen excess. So it's not just the hormonal acne or the abnormal hair growth, which sometimes you'll see someone come into the office and you think, I wonder if this patient has PCOS because of some of those physical characteristics. Right. And so you might probe a little bit more. But the other thing to consider too are the signs of insulin resistance. So there's something called acanthosis nigricans, which is a darkening. It looks like a velvety black or like darkening of the skin in certain areas, like specifically around the skin folds and the axillary or the underarm area, and then around the neckline. That can certainly be an indicator that they have insulin resistance. And the other thing is skin tags in that area. So if you have a lot of skin tags along the neck or under the arm, that can be an indicator of insulin resistance as well. And so sometimes without even talking to the patient, just seeing them, you can see that they might have some signs of PCOS.
And is that something that you instigate as far as a conversation? And like, how can you for sure know that you have PCOS?
So there's something called Rotterdam criteria, which It's the most up to date diagnostic criteria that we use for PCOS right now, and you have to have 2 of the 3 of those criteria. So one of them is it's oligomenorrhea, so it's irregular periods. The other is signs of androgen excess, and so that can be either an elevated testosterone on morning labs, or it can be the hirsutism that I talked about, so the abnormal hair growth, or it can be the acne, the hormonal acne.
So you almost have that. You almost like, I feel like it's reactive. I guess that's what I'm kind of going to. Everything you're telling me is reactive. You can't get ahead of it proactively.
Yeah, and the other thing too that I didn't mention,
it's just so challenging.
It is challenging, and
it's sad almost.
And a lot of times you have to dig and ask questions and have that on your radar, because there have been plenty of women that came into my office that said, I've always had these symptoms. I've had these symptoms for years, and no one's ever even mentioned PCOS before. Like, you're the first person who's even asked me about if I thought this was a possibility.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.